Omniax has been a wonderful adjunct to our practice because it's an extremely versatile piece of equipment. It helps us to identify and treat vertigo that we could never even see before.
The thing about the Omniax is you can also do some vertical axis rotation and assess for some asymmetry in vestibular function. You can also rotate them in the vertical axis planes and get some idea about vertical canal function as well.
It's allowing us to look at other types of traditional diagnosis, such as unilateral weaknesses or perhaps superior canal dehiscences in a whole new light. And we're able to quantify and identify the actual position, location of nystagmus, which in turn helps us to provide a differential diagnosis for that broad term of dizziness.
Prior to the Omniax, we really couldn't look at superior canals. We couldn't really do posterior canal repositionings going 360. It was sort of limited by what you could do with the patient on a table. Whereas with the Omniax, being able to do 360s, both in terms of horizontal canals, posterior canals, superior canals, just dramatically improved our results.
Not only does it allow us to observe the torsional nystagmus typical of BPPV of the posterior canal, but we can also see variants of that where other canals are affected.
Since I've had the Omniax, I've not had the problem of conversion of BPPV from the posterior canal. I don't think I've operated or plugged a canal on a BPPV patient since I've had the Omniax.
Simply because the maneuvers are so much easier to perform on the Omniax, you tend to do a lot more maneuvers in one setting.
When we do try to do positioning or treatment and diagnosis of positional nystagmus in our office chair, we often have to have an assistant with us to help roll the patient, stabilize the patient while the patient's turning and so on, and the Omniax makes that unnecessary.
The other distinction being between canalolithiasis and cupulolithiasis, the ability to repeat the maneuver so easily, the ability to videotape the procedure and go back over and re-review it allows you to be a lot more accurate in your diagnoses.
In many regards, I feel like we're rewriting the book in terms of how to treat patients with vertigo.
The Omniax is certainly a wise investment. Mainly, if anyone owns an Omniax, they're automatically the referral center for anybody with anything more than simple positional vertigo.
Absolutely. I would recommend it to any neurologist or otologist who looks after people with benign positional vertigo and balance disorders in general.
I know that our patient population has increased significantly to the point that I've had to add days in order to handle the load.
Physicians who refer to us and patients in the area who know about us have actually learned about the Omniax device through word of mouth and also through the Vesticon website and sought us out.
It has generated referrals from all over Australia and from overseas as well.
I feel that it has increased our patient referrals, perhaps 30 to 40% for patients that have vertigo.
I thought originally that the patient wouldn't like the Omniax because they usually like hands-on examinations, but much to my surprise and much to their comfort, they prefer the Omniax system.
I've had people call me from Philadelphia and other places on the East Coast where they don't have access to an Omniax device asking if they can come and see me.
I think the chair's been a really good marketing tool.
We want to help patients, and also from a business standpoint, this has been an outstanding investment for us.